Hello friends, in this video we will learn about drug therapy problems. So we will discuss about what is drug therapy problems, types of drug therapy problems, some examples to understand this topic in a better way, and in the last, sample questions which could be asked in exam for practice. So let's get started. Drug therapy problem, as the name itself shows that this is some problem related to the medication therapy. So the definition defines as drug therapy problems, DTPs, or drug related problems, DRPs, are clinical problems related to the use of medications or drugs. So what happens when a patient starts a drug therapy for a medical condition? He or she could usually suffer with some side effects or some unexpected effects. So if those effects really bothering the patient, then as a pharmacist you identify it and then treat it. So it says that in the course of clinical practice, DTPs are often identified, prevented, and resolved by pharmacists because pharmacists are expert of medications. So they have a major role in resolving drug therapy problems. The reference of this whole video is Wikipedia. I will give the link in my description box. So now we will see 7 different categories of drug therapy problems, which are: number 1, if a patient requires additional drug therapy. This could occur when a patient needs more medication to treat their condition. For example, when an untreated condition, preventative or prophylactic, synergistic, potentiating. So a best example is when a patient is using salbutamol on daily basis. So we add on corticosteroids with it. This will give more stable condition and it gives a better result than salbutamol alone. Similarly, levodopa with carbidopa or amoxicillin with clavulanic acid. These are some examples where the main medicine is accompanied by other medicine for a better result. The second example of drug therapy problem is unnecessary drug therapy. This could occur when the patient has been placed on too many medications for their condition and the result is simply not needed and the drug is simply not needed. So no medical indication, non-drug therapy indicated, duplicate therapy, treating avoidable ADRs. So for example, that a patient can treat his insomnia with simply sleep hygiene technique, but the doctor prescribe benzodiazepines or trazodone to him. So this is where the drug therapy is not needed, but he is treating with the medication. So it is an example of unnecessary drug therapy. Similarly, like several medicines have side effects. For example, fluoxetine has insomnia, or some ARBs cause cough. So instead of taking anti-cough syrups, you just need to switch the group of medicine. So we have to look for that if the adverse drug reaction is avoidable, so we switch the group instead of giving unnecessary drug. The third example in drug therapy problem is requires different drug product. This could occur when a patient is given medication that does not treat the patient's condition. For example, more effective drug available, condition refractory to drug, dosage form is inappropriate, not effective for the condition. So simply any example in which you have to change the medicine is come under this therapy. The other example, the other category for drug therapy problem is dosage too low. This could occur when a patient is given medication that is not strong enough to get beneficial or therapeutic effect. For example, wrong dose, frequency inappropriate, duration inappropriate, too short drug therapy. Drug interaction that decrease drug in serum. So usually with antidepressant, this happened that whether we start with the minimum dose and then gradually increase it. So if the dose is too low, then the patient will not respond. Similarly, there are some drug interactions that drug A cause excretion or clearance of drug B. So the metabolism of drug B increase and it clear out from the body faster than the expected time. So the dosage have to improve in this condition. The other is similar to the category 4, which is dosage too high. This could occur when a patient is given medication that is too strong and cause detrimental effect and is simply not necessary. So if a patient is taking too high dosage of a medicine, then definitely they will suffer with side effects. For example, wrong dose, frequency inappropriate, incorrect administration, too rapid administration, drug interaction, other food or drug cause drug concentration high in serum. So basically food or any drug that cause slow down the metabolism of that medicine and it produce more longer effect than expected. And you are taking the dose on regular interval, so it will eventually will be high in the serum. So the next category is adverse drug reaction. This could occur when a patient has an allergic response to a medication. For example, undesirable effect, unsafe drug for patient, dose changed too quickly, allergic reactions. So any adverse drug reaction with that a patient suffer, which it comes under drug therapy problem. Contraindications present. Then next category is non-adherence. This could occur when a patient choose not to or forget to take a medication. This may happen when directions or instructions not understood by the patient. Patient prefer not to take medication. Patient forget to take medication. Drug product is too expensive for the patient. Cannot swallow or administer. So with depressed patients, yes, usually the effect came after several weeks. So the patient prefer not to take medication or they become not adherence with their therapy. Similarly, in other mental diseases like Alzheimer's, they forgot to take medications. And other example for cannot swallow or administer is a patient when they become dependent. They cannot take medication by themselves. So if there is no one to take care of them, they become non-adhere. And other example is drug product not available. So these were 7 categories for drug therapy problems. Now we will discuss some sample questions. MN suffering with mild acne problem on her face. Her doctor prescribed her benzoyl peroxide. After 4 months of treatment, she complains about no visible improvement. Doctor added clindamycin oral. MN's acne is still bothering her. As a pharmacist, can you identify what drug therapy problem MN has? Option A, medicine not appropriate. Option B, more medicine required for synergistic effect. Option C, increased dose of medicine. Option D, MN's therapy requires time to show optimal effect. The best answer is option A. Why? Because for milder acne, papule or pustules, benzoyl peroxide prescribed in the beginning of the treatment. Then topical retinoid or the combination therapy of both are recommended. So when the doctor prescribed clindamycin, this is a wrong or inappropriate medicine. Then another example is SR came to your pharmacy with a prescription of oral prednisone for her eczema. What is the drug therapy problem? Option A, medicine not appropriate. Eczema can resolve without any drug. Eczema is adverse effect of her other drug therapy. None of above. So the D and C is not included because there is no other details given in the question. The answer would be A. Medicine is not appropriate. We will cover this in the topic of eczema, but for now it is A. The next example is JG has following medical profile. Age 30 years old, current medication amitriptyline 75 mg at bedtime, acetaminophen 325 mg as needed for headache. Current medical condition is major depression. It has been 4 weeks of therapy, however, she is not satisfied with her medicine. She complains about dry mouth, constipation, and somnolence since she started this therapy. Which of the following drug related problem is she experiencing? Option A. JG is not compliant with her therapy. Option B. Acetaminophen has drug interaction with amitriptyline. Option C. These are the side effects of amitriptyline. Option D is dose of amitriptyline is low. So the answer is C. These are the side effects of amitriptyline, which is like anticholinergic side effects of TCAs. So another example is continue with the previous question. As a health practitioner, what would be your response to patient's concern? Advise her that antidepressants take time to work. Recommend to wait for 2 to 3 weeks to expect an improvement. Recommend saliva substitute for dry mouth. Call her physician to recommend another agent since she is not getting benefit from this drug and is experiencing side effects. Recommend combination therapy with selective serotonin reuptake inhibitors. Recommend psychotherapy as drug therapy failed to improve her symptoms. So B and C will not valid because we do not combine selective serotonin reuptake inhibitors with TCAs. And psychotherapy will not work here because the patient is actually suffering with side effects. So it's clear answer that the answer is B. That's enough for today. Thanks for watching and please share and subscribe.